Hi, welcome to Live at Lunch, where we are celebrating brain health today. We have here with us Dr. BJ Hicks through Ohio Health, and he's going to talk to us a little bit about brain health and what we need to know. So tell me, first of all, what made you decide to become a physician?
Well, I saw it in my household. My father was a physician, so I was familiar with what they did and what the hours were like. That didn't necessarily scare me off, but I just had an interest as I went through college. I really was fascinated by brain and behavior. So I became a psychology major, actually, because I was just fascinated by how humans interact and different brain-related issues that makes some people act different than others. So I knew that healthcare, neuroscience was something that was blossoming in healthcare. So that led me into seeking out a neuroscience medical career. So once I got into medicine, I just fell in love with neurology and the neurological conditions and diseases that neurologists treat. And I also wanted to make an impact on something that could be potentially devastating, but yet very treatable. And that's what led me to stroke. And I've never looked back.
Well, the brain is fascinating, and you mentioned stroke. So tell us what we need to know about strokes and how we can prevent having a stroke.
Stroke is preventable and stroke is treatable. So these are two things that I always like to start with. So, whenever I'm in a situation like this or at a cocktail party or just anywhere and somebody says, what can I do to make sure I don't have it? 80% of strokes can be prevented by doing two things. If you smoke, stop immediately and never pick up the habit. And that sounds really easy in certain demographics because certain parts of this country, we've done a great job of letting people know, and especially young people, that smoking is not what you want to do. So certain parts of our community, the smoking levels are minuscule, but that's not the case in other places, primarily in underappreciated and underserved, underutilized urban areas, as well as rural populations. These are two places that people are still smoking at high levels. So that's one thing that we need to do. And the second thing is know your numbers with blood pressure. High blood pressure is a major driver of stroke. So those are two big things that we can do. There are other things like, if you have diabetes, get that under control. High cholesterol can cause it. Lifestyle things like ensuring that you're exercising majority of the week, getting your heart rate up for at least 20 to 30 minutes a day. I'm not saying what you need to do. I joke all the time that, if you see me running somewhere, something terrible has happened behind me, even though my wife finds running liberating. But, that's just not how I choose to exercise. And it's not one thing that does it. You just need to get your heart rate up. And then a diet, what you put in your body is something that people do not always recognize and appreciate. And so there's a lot of great science behind the Mediterranean diet. I won't go into the detail, but that's something that the viewers could look into because we're now seeing that people that adhere to the Mediterranean diet, they're living longer lives, they're living happier lives and healthier lives for brain health, for heart health, for diabetes, for everything.
And that's based on healthy fats, correct?
Correct, as well as, green leafy vegetables, olive oil, olives, nuts, using snacking, kind of revolving around fruits, vegetables, nuts. If you're going to have meats, lean meats, these sorts of things are very important within the Mediterranean diet. You can still go out to eat at phenomenal restaurants near home care assistants. I've been to several, and still adhere to the Mediterranean diet. It's really something that is not like something you dial a 800 number or get on a website and pay a certain amount of money. it's a natural way of eating that I think people could gravitate to once they give it a try.
It's all about healthy choices, right?
That's a
Making the
fact.
right decisions.
That's a fact. Other things, one last thing
Yeah.
that people don't appreciate is sleep. Sleep is a big, it's a big issue with stroke risk, because sleep apnea is something that could impact brain health. It increases your risk of heart disease and stroke. It increases your blood pressure. It causes cognitive memory problems. So it can cause headaches. So people that that come in and say, I've had a stroke and I'm not sure why, I'm often having them checked for sleep apnea. And if you have it, it's not always the best type of treatment options available. People tend to resist it, but it is extremely impactful for your brain.
Okay. Well, Dr. Hicks, I've known you since we're young kids,
Yep.
but why don't you share some things that keep you up at night? What kind of gets your mind preoccupied?
These days, I'm always thinking about equity in everything that we do. I think that that's something that everybody should be thinking about in every walk of life, every facet of employment. How can we make sure that we are giving amazing quality care to every single person that we can interact with? And are we missing segments of a population that otherwise could benefit from great things that we could provide? So at Ohio Health, for instance, and with stroke care, I think the mobile stroke treatment unit is an excellent example of that. We have great care at Riverside Hospital. The zip code of Riverside Hospital is arguably one of the most affluent in the city. So people aren't always able to get to Riverside within a few minutes.
Sure.
So there are other parts of town that don't have a Riverside-like treatment model anywhere near them.
Right.
So, and for stroke, time is everything. So getting to Riverside within a few minutes versus a half an hour, 40 minutes can be the difference between walking out of the hospital or staying for rehab or God forbid, never leaving the hospital because of an untimely death.
Real quick, remind us what BFAST stands for.
So BFAST is an acronym that we use to make sure that people know the stroke signs and symptoms. The problem with stroke is that it's not always painful, so people aren't always rushing to the hospital. They're not rushing to dial 911 like if you were in a car accident or if you had a terrible heart attack and it's pressing your chest. So people need to understand that the acronym BFAST tells you that if you have sudden symptoms like this, you dial 911, you do not mess around, you don't call my office, you don't call your family, you call 911, and the BFAST stands for balance, sudden balance change. E is for eyes. If your eyes suddenly go one way or the other, or if you lose vision suddenly out of one section of your vision or your entire eye, your vision's lost, that's typically painless. F is for face. If your face suddenly droops down and you don't have an explanation as to why on one side of the face. A is for arm. If your arm suddenly drifts or cannot move at all, same with the leg. S is for speech. If your speech suddenly changes, you're slurring your words, you're not getting your words out the way that you typically do, or if your words are jumbled and nonsensical. And finally, T is for time.
That's
like I mentioned, time to dial 911 as soon as possible.
Sure. Well, we know what keeps you up at night, but what energizes you? What gets you going every day?
Things that energize me are out-of-the-box thinking to improve our communities or to improve our way of life. I think groupthink can be detrimental in a lot of different ways, and it allows us to feel very comfortable and just kind of pushing things along, but not really driving innovation.
Okay.
And I think that, again, no matter what you do, it doesn't have to be stroke care, it doesn't have to be home care, but there's certainly ways within those two avenues where you can do out-of-the-box thinking to be impactful for those that you serve. So whenever I see innovation, out-of-the-box thinking for the good of humanity, that really gets me excited.
That's awesome. Well, I'm so happy to have you here. Our mission is changing the way the world ages, and I truly believe you are doing the same. So it's an honor to have you here, and I look forward to sharing with everyone the mobile stroke treatment unit coming up shortly. So thank you again for coming, and thank you for joining us at Live at Lunch. If you would like more information about strokes, you can find Dr. William B.J. Hicks at ohiohealth.com and just look under stroke. If you'd like to reach us and learn more information about home care assistance, you can find us at our website below. Thanks so much.